administration is the process of safely and accurately giving medication to another person. Throughout this course, you will be learning and developing the skills required for proper medication administration. Following the guidelines taught in this video and the medication administration course will help ensure that you provide safe and accurate medication administration for your clients. Administering medication is a huge responsibility. When administered correctly, medications can improve a person's health. When administered incorrectly, medications can cause harm or even death. Because medications are given many times each day, it is easy to overlook the importance of safe administration. It is up to you to prevent medication errors. To help ensure this, you must always follow the 6 rights of medication administration. Following the 6 rights means that every time you give medications, you are making sure you have the right client, give the right medication, give the right dose, use the right route, give the medication at the right time, and provide the right documentation. The 6 rights are key to safe medication administration and decrease the chances of making medication errors. Let's review each of the 6 rights separately. Make sure you have the right client. Each time you give medications, you must identify the client. Giving medications to the wrong client can cause serious harm. There are 3 ways you can properly identify a client. One method is to check the name on the client's armband, either visually or with a barcode. A second is to have a picture of the client with the Medication Administration Record, MAR. A third method is to ask the client to state their name, if they are able to respond. Make sure you give the right medication. You must perform 3 medication checks prior to giving a medication, making sure that the medication name, dose, date, time, and route on the medication label matches the information on the MAR. Make sure you give the right dose. The MAR and the medication label will state exactly how much medication is to be given. Make sure you use the right route. The medication route ordered, whether by mouth, ear, nose, skin, or other route, will be listed on the MAR. Make sure you give the medication at the right time. The right time to give the medication is stated on the MAR and the medication label. Each agency has a limited window of time for the medication to be given. The time can range from 30 minutes to 1 hour before to 30 minutes to 1 hour after the time stated on the MAR and the medication label. Medications must be administered within this designated time frame. If you are unsure about giving the medication because it is outside the designated time frame, check with your supervisor before administering the medication. Make sure you provide the right documentation. After administering medications to a client, the medication aide must document the day and time the medication was given on the MAR. Immediate, clear, and accurate documentation shows that the right dose of the right medication was given to the right client at the right time, on the right date, by the right route. The Medication Administration Record, or MAR, holds the instructions for medication administration for all your clients. You must always refer to these records when giving medications. Never give medications from memory. If your agency uses pictures with the MAR, Check the picture prior to giving the medication. Check that the picture in the MAR matches your client. At this time, you can also check for other information on the MAR, such as a client's known allergies. When reviewing the client's medication administration record, you should first identify which medications need to be given routinely. If your client needs a PRN or as needed medication, you can prepare this medication at the same time. After you have identified which medications are to be given, unlock the cart and unlock the medication doors. Place the keys on top of the cart within your field of vision. As you remove the medications one at a time, you will begin the first of 3 medication checks. The first check happens when you remove the medication from where it is stored. The second check happens just before or after opening the medication and preparing it for your client. The third check happens before you give the medication to the client. With each check, make sure that the medication name, dose, date, time, and route listed on the label matches the information listed on the MAR. You must do this for each medication. Again, check to be certain that you have the right medication, dose, route, time, and client. Before pouring liquid medications, always shake the bottle well. When you remove the cap, place it upside down to prevent contamination. Turn the label toward the palm of your hand to protect the label from spills while pouring the liquid. After pouring the correct amount of liquid, replace the cap on the bottle. Take the medication cup with the measured dose and set it on a level surface to double check the amount measured at eye level. This method assures you have the correct dose. Try to avoid working over the MAR to prevent spilling on the records. When removing pills, pour the correct number of tablets into the lid. If you pour more pills than are needed, pour the extra pills back into the bottle. Pour the correct number of pills into the medication cup and replace the lid on the bottle. Using the lid to measure out the pills prevents contamination of the medication. As you return the medication bottles back to their storage place, you will perform the third medication check for each bottle, checking the medication name, dose, date, time, and route against the MAR. Before leaving the cart, close the drawer. Close and lock the medication cart doors and lock the cart. Close the MAR to prevent unauthorized persons from viewing private medical information. You are required by law to protect your client's privacy and to keep their personal health information confidential. Remember to pour a cup of water for the client to drink with their medications. After the client takes the medication, return to the cart and document that the medication was taken by initialing the correct spaces on the MAR. For each PRN or as needed medication given, you must initial the MAR and document the time and reason the medication was given. Always follow your agency's policy for documenting the time and the reason for administering the medication. Agencies vary in the way the medication aid is to document their initials and signatures. Some have master signature lists, while others have you sign the signature section on each MAR sheet. It is important to follow your agency's policy and complete this documentation so that other personnel can identify who gave the medication. Always indicate Med Aid or your agency's position title behind your name when documenting medications given. This will identify you as the medication aid. When you finish, close the MAR book and move to the next client. When a client asks for a PRN or as-needed medication, you will need to check to see if they can have it at this time. If the medication is a controlled drug, it will be kept in the locked controlled substance medication drawer. You must unlock the cart and the controlled substance drawer to get the medication for the client. Remove the right medication from the drawer. Compare it to the MAR to make sure you give the right dose of the right medication to the right client at the right time and by the right route. Refer to the controlled substance sheet and verify the remaining count of this medication before removing the needed number of pills. The numbers must match exactly. If they do not, alert your supervisor immediately. Remove the needed number of pills and place them in a paper medication cup. Document the number of pills you removed on the controlled substance sheet, completing all required information, including signing your name. Record the number of remaining pills at the end of the row and carry that total to the start of the next row. Fold and attach the sheet to the remaining medications and return them to the drawer. Close and lock the drawer and then lock the cart before taking the medication to the client. Please pause for review and practice. The first important action before beginning medication administration is to wash your hands. Washing your hands is a critical part of medical asepsis, a term used to describe methods of decreasing the spread of germs from one client to another. This practice of medical asepsis is also called hand hygiene. Often people ignore this simple task because they do not think it is important. Actually, hand hygiene is the single most effective way of preventing the spread of germs from one person to another. The Centers for Disease Control estimates that each year, nearly 2 million patients in the United States get an infection in hospitals, and about 90,000 of these patients die as a result of infection. Thorough hand washing with antibacterial soap and water is the best way for people who are working in healthcare settings to keep their hands clean. You should also keep your fingernails clean and short and avoid wearing artificial nails, which are hard to keep clean. You should wash your hands when you arrive at your workplace, prior to beginning any task, including medication administration, before and after every client contact, after removing gloves, before and after eating, after using the toilet, and before leaving the workplace. You should also wash your hands with soap and water anytime your hands are visibly dirty, contaminated, or soiled. Before washing your hands, be sure to remove jewelry from your fingers and wrists and place them in a safe place. Watches can be removed or slid up your arm. Turn the water to warm. Wet your hands and leave the water running. Apply a large drop of liquid antibacterial soap. Keep your hands lower than your elbows to allow germs to run off your fingertips rather than up your arms. Scrub your hands rapidly, working the soap into a lather. Rub all areas of your hand, including the backs of your hands, between the fingers and thumbs, and around the wrists. Also, clean around and under your fingernails. Continue to rub your hands rapidly, washing your hands for 10 to 30 seconds. Rinse your hands well, again, holding them so that the water runs off the fingertips. When you are finished, leave the water running while drying your hands thoroughly with paper towels. Avoid cloth towels since they can hold germs and put germs back on your clean hands. Throw away the paper towels without touching the trash can lid. When you have finished drying your hands, use a dry paper towel to turn off the water. This protects your hands from touching germs on the faucet handle. When hands are not visibly soiled, an alcohol-based hand rub can be used instead of hand washing to reduce the number of germs on your hands. Apply a small amount of solution to the palm of one hand. Rub the solution into your hands, covering all surfaces, including around your nails and between your fingers. Rub your hands together until all the alcohol has dried and evaporated. Wearing clean gloves as a protective barrier is required as part of standard precautions every time you come in contact with body secretions. Clean gloves are used in medication administration when applying eye ointment or drops, topical medication to skin, vaginal or rectal medications, and every time you come in contact with blood or body secretions. Gloves should be removed immediately when you finish a task, and hands should once again be washed. Please pause for review and practice. Prior to administering medications, you must prepare your work area, whether it is on a medication cart or in a medication room. You need to gather all the supplies you will use to administer medications. You may find that the supplies vary from agency to agency. As an overview, this video demonstrates setting up the general supplies needed for a medication cart. You will need clean gloves and hand gel to prevent the spread of germs from client to client and to protect yourself. Alcohol wipes are useful for small cleanup jobs. Surgilube is used for vaginal and rectal medication administration. Band-aids and tape are for topical medications. The pill cutter and mortar and pestle are used for cutting and crushing pills. Tissues are necessary for administering certain medications. Tongue blades are used for applying topical medications. Spoons are useful for stirring medications. Medication cups come in a variety of sizes and textures and are stored face down to prevent dust and other particles from falling into them. Always prepare a pitcher of fresh, cool water to assist the client with swallowing their medication. Some clients prefer to drink their water using straws. Disposable drinking cups are used for water and for mixing oral powder medications. The medication administration record book and an ink pen are required for accurate documentation. The cart must be kept locked at all times when you are not using it. You must keep the keys with you for your entire work period, unlocking the cart to get the client's medication and relocking it each time you step away from the cart. Carts vary in their locking mechanisms, so you need to be familiar with your agency's equipment. Most carts have a master lock that unlocks the entire cart and the second lock that unlocks the section that holds the controlled substances. This particular cart also has a separate lock to access routine medications. Controlled medications are kept in a separate locked portion of the cart. This provides a double lock system to protect the controlled medications from tampering and theft. While you are working as a medication aide, you are responsible for all the medications in the cart. You must be extremely careful about the security of the cart. This means never giving the keys to any unauthorized persons and locking the cart each time you leave it. Remember, you will be held responsible for any missing medication. Please pause for review and practice. Medications come in many different forms and are administered in a variety of ways. Oral medications are the most common and are taken through the mouth. Oral medications can be solid or liquid. Solid medications come in several forms. Tablets and caplets are compressed, measured amounts of medication. Some have a special coating to prevent stomach upset. The coating allows the medication to pass through the stomach to be dissolved and absorbed in the small intestine. Capsules are gel-like containers filled with measured amounts of medication in powder, liquid, or oil form. Liquid medications also come in various forms. They can be solutions, suspensions, syrups, and elixirs. Many medications have special instructions in addition to the dose, time, and route. These instructions are listed on the label and on the MAR. Some examples of these are: shake well, keep refrigerated, take with liquids, take before or after eating, take with food, or do not take with certain foods. Because some clients have difficulty taking oral medications, there are several methods the medication aide may use to assist them. One method is to place the pill at the back of the tongue. Another is to disguise the taste by placing it in a small amount of applesauce or pudding. A third method is to have them drink a sip of water before taking the pill. You should always have a cup of water ready for the client when they are taking oral medications. Another factor to consider when administering oral medications is how your client is presently feeling. You should never give oral medications to a client who is vomiting. If your client is vomiting, you should wait to administer oral medications until they are feeling better and are able to keep the medications down. If you have to delay giving the medications, tell your supervisor. When preparing to administer medications, remember to gather any additional supplies you will need. Some medications need to be mixed with juice or food products. Unlock the cart and place the keys on top of the cart in your field of vision. At this point, you will perform the first of the 3 medication checks. Check the MAR for the right client, the right medication, the right dose, the right route, and the right time. Some pills require that they be crushed or cut in half. Some pills are scored with a carved groove, which means it can be cut into two equal halves. Wearing gloves, place the tablet in the pill cutter, lining up the groove with the blade. Firmly press down on the cutter until the pill is split. If the pill does not split into two equal halves, dispose of them according to your agency's policy and cut another pill. Pills that are not scored are not to be cut because the two halves will not have equal doses. When you are finished, clean the pill cutter with an alcohol wipe, being careful not to cut yourself on the blade. Each time you enter the client's space, you must tell them why you are there and which medications they are about to take. You must identify that you have the right client. When administering pills, encourage the client to drink a significant amount of liquids. You must check to see that the client took their medications before you leave. Look into the client's mouth to make certain they swallowed them and are not hiding the pills to avoid taking them. According to the MAR, this particular pill requires crushing. There are several ways to crush a pill, and the technique may vary from agency to agency. Some methods involve using a mortar and pestle. One method is to crush the pill in a paper medication cup. In order to contain the medication in the cup, place a second paper cup on top of the pill. Place the stacked cups inside the mortar and use the pestle to crush the pill into a fine powder. Another way to crush pills is with a levered pill crushing device. Again, place the pill between two paper medication cups. You usually need to hammer the pill several times before the pill is crushed into a fine powder. If the medication comes in an individual package, you can leave it unopened and place the package in the mortar. Use the pestle to crush the pill into a fine powder. You can then open the package and pour the powder from the package. The least preferred way of crushing a pill is to place the pill in a clean mortar and use the pestle to crush the pill directly. You will need to use a clean tongue blade to scrape the medication powder from the mortar into the medication cup. The problem with this method is that you lose some of the medication because it adheres to the surface of the mortar and pestle. You must also clean the mortar and pestle before returning them to their storage place. Once the pill is crushed into a fine powder, you can mix it with applesauce or pudding. Use only a small amount of food product because the mixture will taste bitter and it is necessary for the client to eat the entire portion. Always remember to date the food container according to your agency's policy. Some medications require mixing before administering. Metamucil is one example and can be mixed with water or juice. Empty the pre-measured amount of Metamucil into the juice. When using a straw to stir, tear the paper wrapping from the straw so that your hand does not touch the portion of the straw going into the cup or into the client's mouth. Note that Metamucil will turn to gel if it sits too long, so it needs to be given shortly after mixing. Before taking the medications to the client's room, mark your place in the MAR, close the book, and lock the cart. Always introduce yourself when you enter the client's living space. Check that you have the right client. Tell the client why you are there and what medications you are giving them. Unless the MAR indicates a specific sequence, the client can choose which medication to take first. Stay with the client and watch to make sure they take all of their medications. When the client is finished, return immediately to the MAR and document that the medications have been given. Remember to practice good hand hygiene before and after medication administration. If your hands are not visibly soiled, you may cleanse your hands with an alcohol-based hand gel between clients. Always provide the right documentation in the correct space on the MAR after each client has received their medication to avoid errors. When pouring liquid medications, pour them at eye level to get a more accurate measurement. After pouring, set the measuring cup on a level surface to double check you have poured the right dose. If you accidentally pour too much into the medicine cup, simply pour small amounts out into another cup until you get the correct dosage. Never pour liquid medication back into the bottle to prevent contaminating the remaining medication. Remember to perform the 3 checks to avoid giving your client the wrong medication. Always keep the medication cart securely locked when you leave. Before taking the medications to the client's room, mark your place in the MAR. Remember to pour a cup of water for the client to drink with their medications. Identify that you have the right client and tell them why you are there. Sometimes clients find it helpful to wet their mouth with water before taking liquid medications. When you have finished giving medications, cleanse your hands with hand gel or by washing them. Gather the supplies that need to be refrigerated and return them to the refrigerator. Move the locked cart to the agency's designated storage place. Most agencies require the locked cart to remain in a locked storage room to keep it secure when it is not in use. Many liquid medications come with droppers to provide accurate measurement of the medication. It is important to use the dropper that comes packaged with the medication to be sure you give the right dose. When you open the package, remove the lid from the bottle and insert the dropper. Throw away the lid and leave the dropper in the bottle for later use. To get the right dose into the dropper, pull the dropper out of the bottle far enough to see the marked measurements. Squeeze the bulb on top of the dropper and slowly release the pressure. Keep the same amount of pressure on the bulb and move the dropper over the medication cup. Squeeze the bulb completely to dispense the medication into the medication cup. When liquid medications do not come with a dropper, you will use a metered medication cup to get the right dose. In order to assure accurate dosing, if the amount to be given is less than 5 cc's, you will use a syringe. Oral syringes are designed with an off-center tip to administer liquid medications to children and adult clients who cannot drink from the medication cup. The off-center tip identifies these as oral syringes as opposed to injection syringes. Some agencies use a special stopper designed with a hole in the center. This allows you to insert the tip of the syringe into the stopper to make it easier to draw up the right dose. This stopper can also be left on the bottle in place of the cap. If you do not have a stopper, you can pour the approximate amount into a medication cup and draw it up into the syringe from the cup. After inserting the oral syringe, invert the bottle and withdraw the exact amount of medication listed on the MAR. Turn the bottle upright and withdraw the syringe. Close the stopper on the bottle and return the medication to its storage place. Always perform the 6 rites of medication administration. When administering oral medications to a client who is a child, always put on clean gloves because you may come in contact with saliva. At this point, you will perform the first of the 3 medication checks. Check the MAR for the right client, the right medication, the right dose, the right route, and the right time. Explain to the parent or guardian how you will administer the medication so they can understand and assist you. Giving medication to a child is easier if the parent or guardian holds them. Gently hold the child's chin and slowly inject the medication along the side of the mouth between the gums and the cheek, which prevents the child from choking and from spitting out the medication. Allow the child time to swallow and gently squeeze in more of the medication. Take a few minutes to offer comfort to the child when you are finished. Buccal medications are oral medications that are designed to be dissolved in the mouth. They are not to be swallowed whole. Buccal medications are placed between the cheek and the gum on either side of the mouth. They dissolve quickly and get into the bloodstream for an immediate effect. Always introduce yourself when you enter the client's living space. Identify that they are the right client and tell them why you are there. Buccal medication is absorbed better when the mouth is wet. Ask the client to drink some water before placing the medication in their mouth. Because you may come in contact with saliva, always put on clean gloves before administering the medication. Place the tablet along the side of the cheek, between the cheek and the gum. Instruct the client to neither chew nor swallow the pill, but to let it dissolve. Tell them they are not to eat, drink, or smoke until the medication is completely dissolved. When you are finished, remove your gloves and wash your hands.
All right.
Sublingual medications are oral medications that are designed to be dissolved in the mouth. They should not be swallowed whole. Sublingual medications are placed under the tongue, where they dissolve quickly, getting into the bloodstream for an immediate effect. Always identify that you have the right client. This time, the identification method used compares the picture on the MAR with the client. Always perform the 6 rites of medication administration. For some medications, you may need to take the bottle with you to the client's side. If the client is able to assist, tell them to place the tablet under their tongue. If the client is not able to assist with placement of the tablet, put on gloves and place it under their tongue for them. Instruct the client to neither chew nor swallow the pill, but to let it dissolve. Tell them they are not to eat, drink, or smoke until the medication is completely dissolved. If your client is having chest pain, stay with them until the pill is dissolved and the pain has gone. Your presence can be calming and reassuring. Please pause for review and practice.
Okay.
eye medications are used to treat inflammation and infection. Check the MAR to determine which medication is to be given and which eye, or if both eyes, are to be treated. Always introduce yourself when you enter the client's living space. Because you may come in contact with tears, always put on clean gloves before administering the medication. It is important to wash your hands before and after administering eye medication. Remove the lid from the eye drop bottle and lay it on a clean surface. It is very important to not let the tip of the dropper touch the client's eye or eyelashes, nor your hands or fingers. This will prevent possible injury and the risk of getting germs on the dropper. Tell the client to gently tilt their head back and to look up and away. With the client's permission, gently pull down the lower eyelid. This will create a pocket for the drops. Drop the exact number of drops listed on the MAR into the eyelid pocket. After administering the drops, gently press the corner of the eye at the bridge of the nose for 1 minute. This will prevent the medication from draining into the mouth. In order to spread the medication completely over the eyes, ask the client to gently close their eyelids and roll their eyes around. When you are finished, remove your gloves and wash your hands. Applying eye ointment is similar to applying eye drops. Tell the client to gently tilt their head back and to look up and away. Remember not to let the tip of the tube touch the client's eye or eyelashes, nor your fingers or hands. With the client's permission, gently pull down the lower eyelid. Spread an even ribbon or line of ointment into the pocket. Ask the client to gently close their eyelids and roll their eyes to evenly spread the medication. Because it is common for the client's vision to be blurred after eye ointment medication, tell the client to remain sitting for 10 minutes following treatment. This will prevent them from falling or having an accident while walking with blurred vision. Please pause for review and practice.
All right.
Ear medications are used to treat inflammation and infection. Check the MAR to determine which medication is to be given and which ear, or if both ears, are to be treated. Always introduce yourself when you enter the client's living space. Because you may come in contact with ear drainage, always put on clean gloves before administering the medication. To avoid injury and to prevent getting germs on the dropper, it is very important to not let the tip of the dropper touch the client's ear or hair, nor your fingers or hands. Tell the client to gently tilt their head to the non-affected side. Because the adult ear canal is in the shape of an S, you must straighten it to allow the medication to enter the canal. To do this, gently pull the ear up and back. Drop the exact number of eardrops listed on the MAR into the correct ear canal. Encourage the client to keep their head tilted for 2 minutes to allow the medication to enter the ear. The ear canal points upward in infants and children up to 3 years of age. To straighten the canal in a child this age, you must gently pull the ear down and back before administering the drops. When you are finished, remove your gloves and wash your hands. Please pause for review and practice. Nasal medications are used to treat inflammation and infection or to deliver other medications. Check the MAR to determine which medication is to be given and which nostril, or if both nostrils, are to be treated. Always introduce yourself when you enter the client's living space. Because you may come in contact with mucus from the nose, always put on clean gloves before administering the medication. Give the client a tissue and have one ready for use after administering the medication. To avoid injury and to prevent getting germs on the dropper, it is very important to not let the tip of the dropper touch the client's nose nor your fingers or hands. Ask the client to gently rest their head back on the chair, being careful that they do not strain their neck. Drop the exact number of drops listed on the MAR into the correct nostril or nostrils. Because the client has breathed on the dropper, it is important to wipe it off with a tissue prior to returning it to the bottle. Once used, this bottle of nose drops can only be used by the same client. When you are finished, remove your gloves and wash your hands. Administering nasal spray is similar to administering nose drops. Give the client a tissue and have one ready for use after administering the medication. When administering nasal sprays, ask the client to insert the bottle into one nostril and block the other nostril by pushing against it with your finger. Instruct them to inhale through their nose while squeezing the bottle. Make sure the client inhales the correct number of sprays listed on the MAR. Because the client has had the nozzle in their nose, it is important to wipe it off with a tissue prior to recapping. Once used, this nasal spray bottle can only be used by the same client. When you are finished, remove your gloves and wash your hands. Please pause for review and practice.
Okay.
Inhalant medications treat diseases that affect the lungs, and they are only effective when they reach the lungs. The most common method for administering inhalant medications is through the use of metered dose inhalers. The type of inhaler and the right dose will be designated on the MAR. If more than one metered dose inhalant is needed, the sequence and the number of puffs for each will be indicated on the MAR. Always introduce yourself when you enter the client's living space. Check that you have the right inhalant medication by gently sliding the medication canister out of the plastic holder. After reinserting the canister into the inhaler, remove the cap from the mouthpiece and insert the inhaler into the wide slot end of the spacer. Spacers assist clients to inhale the complete dose of medication. Prepare the medication by vigorously shaking the device and hand the inhaler to the client. Ask the client to breathe out through their mouth and depress the medication canister to dispense the medication into the spacer. They should take a long, deep breath to inhale the medication and hold it for 10 seconds. If the client is unable to take a deep breath, have them take 2 to 3 short breaths to inhale all the medication from the spacer. Wait at least 1 minute before repeating the procedure if more than 1 metered dose is required. Another method of using a metered dose inhaler is to have the client hold the medication canister in front of their mouth without a spacer. Instruct the client to exhale completely while holding the canister 1 to 2 inches away from their mouth. They should inhale deeply while depressing the medication dispenser and hold their breath for 10 seconds before exhaling. A third method is to have the client place the inhaler mouthpiece into their mouth, sealing their lips around it. As they inhale, they should depress the canister and continue inhaling slowly and deeply, holding their breath for 10 seconds to allow the medication to be absorbed. Whenever inhalers or spacers are used, you must clean their mouthpieces with alcohol wipes, recap all the devices, and store them until the next time the inhalant medication is to be administered. Once used, the metered dose inhalers and the spacers can only be used by the same client. When you are finished, remove your gloves and wash your hands. Please pause for review and practice.
All right, let's see. Transdermal.
Transdermal or medicated patches are self-adhesive and applied directly to the skin to slowly release the medication that affects the whole body or has a systemic effect. After checking that you have the right medication and the right dose, open the package to remove the patch. Always put on clean gloves to keep the medication from coming into contact with your skin. This will prevent you from accidentally receiving a dose of the medication. The patch may stay in place for a few days or for several weeks. Check the MAR to determine which medication patch is to be given, where it should be applied, and how long it should stay on. Write the date, time, and your initials on the patch before placing it on the client. This allows anyone caring for the client to readily see when the patch was applied. Remove any previous patch of the same medication to avoid giving the client too much medication. You must also rotate where you place the patch on the client's skin to avoid skin irritation. Before applying, bend or fold the patch. This will make it easier to remove the protective covering. Remove only 1/2 of the adhesive covering and place the patch in the desired location. After smoothing down the first half of the patch, remove the second half of the adhesive covering and smooth the remaining portion of the patch to the skin. To ensure that the client receives the full dose of the medication, be sure that the patch is completely adhered to the skin. When you are finished, remove your gloves and wash your hands. Please pause for review and practice.
All right.
Topical medications are designed to treat affected areas of the skin. Topical medications come in several forms, including ointments, lotions, pastes, creams, powders, sprays, and shampoos. Always introduce yourself when you enter the client's living space. Because you may come in contact with the medication and body fluids, always put on clean gloves before administering topical medications. If you do not have a suitable workspace, you can create a clean workspace by laying down a paper towel. When removing the lid or cap from a container, always turn the lid up to prevent the inside from picking up germs. When applying topical medications, you should only apply a thin layer unless instructed differently on the MAR. You may use sterile gauze or a cotton-tipped applicator to apply the medication. When using a gauze bandage, apply the ointment to the gauze instead of the wound using a sterile tongue blade. This will prevent irritating the wound. To avoid contaminating the ointment, do not reuse the tongue blade. Remove the old gauze and discard it. Apply the gauze and secure it with tape. When you are finished, discard the used supplies and your gloves in the trash. When applying topical medication to a small area, use a sterile cotton-tipped applicator or sterile gauze. Again, discard the used supplies and your gloves in the trash when you are finished. When applying powder, sprinkle it lightly and evenly onto the affected skin. Wearing gloves, gently rub in the powder if needed. Be careful not to inhale the powder dust. When you are finished, remove your gloves and wash your hands. Please pause for review and practice. Vaginal medications come in several forms, including creams, tablets, and suppositories. These medications dissolve at body temperature and are absorbed through the wall of the vagina. Check the MAR to determine which medication is to be given. Because you may come in contact with vaginal secretions, always put on clean gloves before administering vaginal medications. Position the client with her knees bent and spread apart to prepare for medication administration. Always provide privacy for the client. Special applicators are needed for inserting suppositories, tablets, and creams into the vagina. Suppositories and tablets use a similar applicator. If the medication is foil wrapped, remove the foil before placing it into the applicator. Gently pull back the plunger before putting the medication into the applicator. Lubricate the vaginal suppository or tablet to allow for easier insertion. Using your non-dominant hand, spread the labia or lips of the vagina. With your dominant hand, gently insert the applicator and depress the plunger to insert the vaginal suppository or tablet into the vagina. Because the applicator is used over and over for the same client, place the used applicator on a paper towel and wrap it up. Remove your supplies, remove your gloves, and wash your hands. Make the client comfortable, asking her to remain in bed for about 30 minutes to allow the medication to be absorbed. Put on a fresh pair of clean gloves and take the applicator to the sink. Wash it thoroughly with antibacterial soap. Then rinse and dry it. Wrap the clean applicator in a new paper towel and store it according to your agency's policy until it is needed for the next dose. When you are finished, remove your gloves and wash your hands. It is important to wash your hands before and after administering vaginal medications. Please pause for review and practice.
All right.
Rectal medications are used to treat local inflammation and systemic symptoms and come in the form of suppositories or enemas. Suppositories are semi-solid, oval-shaped medications that dissolve at body temperature and are absorbed through the lining of the rectum. Check the MAR to determine which medication is to be given. To keep suppositories firm, they are often kept refrigerated. Check the MAR for the right client, the right medication, the right dose, the right route, and the right time. Wearing a clean glove, remove the correct number of suppositories from the medication canister and place them in a medication cup. Wearing a glove prevents you from introducing bacteria into the canister. Return the suppository container to the refrigerator. Gather needed supplies such as lubricant, absorbent pad, and gloves before approaching the client. Always introduce yourself when you enter the client's living space. Be sure to provide privacy for the client before you begin. Identify that they are the right client and tell them why you are there. Position them onto their left side with their right leg slightly bent. Place an absorbent pad under the client and cover them to provide warmth and added privacy. It is important to wash your hands before and after administering rectal medications. Because you may come in contact with feces, always put on clean gloves before administering rectal medications. Hold the suppository between your fingers and apply lubricant to the suppository. This will aid with insertion and prevent discomfort. Gently place the tip of the suppository against the rectal sphincter and push the suppository into the rectum as far as your finger will reach. After inserting the suppository, use both hands to squeeze the buttocks together. This will assist the client with holding in the suppository. Some suppositories come individually wrapped in foil. Wearing gloves, remove the foil and hold the suppository between your fingers to apply lubricant. Gently place the tip of the suppository against the rectal sphincter and push the suppository into the rectum as far as your finger will reach. Use both hands to squeeze the buttocks together to assist the client with retaining the suppository. When the suppository is used to help the client empty their bowels, be sure to ask the client not to flush the toilet until you have had a chance to check the results of the suppository. If they use a bedpan or bedside commode, check the results before disposing of the contents. Enemas are used to deliver medications or to assist the client with emptying their bowels. Enemas may be prepackaged or prepared at the bedside. After gathering the supplies needed to administer an enema, you will once again need to put on clean gloves. Remove the cap from the applicator and gently insert the pre-lubricated tip into the rectum. Slowly roll the pre-filled bottle, folding it from the bottom to the top as you squeeze the enema fluid into the rectum. Be careful not to push on the rectal wall. Carefully remove the applicator tip from the rectum and squeeze the buttocks together for a few seconds until the client's urge to defecate passes. Place the client on the bedpan. Give them toilet tissue and leave the call button within their reach. Ask them to retain the enema as long as they can and to call for you when they are finished. When an enema is used to help the client empty their bowels, be sure to note the results from the enema before emptying the bedpan. When you are finished, remove your gloves and wash your hands. Please pause for review and practice. These are additional medication administration guidelines that medication aides should know and follow. Some clients have conditional restrictions regarding their medications. For example, certain medications may not be given if the client's blood pressure or pulse is too low. Always check the MAR to determine if any of your clients have restrictions that you need to be aware of before administering their medications. Your agency will direct you on how to handle these situations. Protect your client's dignity by respecting their privacy. By law, you must protect the privacy and confidentiality of your client by not allowing visitors or other clients to know what medication your client is taking. When administering medications, especially topical, vaginal, or rectal. Provide privacy for your client by shielding them from others with a curtain or door and by covering them when necessary. Stay focused. Once you begin administering medications, do not stop unless there is a life-threatening emergency that demands your attention. If you must leave the medication cart, remember to lock it. Avoid giving medications in public places, such as dining rooms or hallways. The chance of making an error increases in these kinds of environments because it is easy to get distracted and make errors. Let's review the key points of medication administration. As a medication aide, you should always prepare your workspace and gather your supplies so that you can stay focused on the task of medication administration once you begin. Protect your client's privacy. You are required by law to keep their personal health information confidential. Practice proper hand hygiene at all times to protect your clients and yourself. Always refer to the Medication Administration Record, or MAR, when administering medications. Never give medications from memory. Always follow the 6 rights of medication administration. Remember, following the 6 rights means that every time you give medications, you are making sure you have the right client. Give the right medication. Give the right dose. Use the right route. Give the medication at the right time and provide the right documentation. Following these guidelines and practicing the 6 rights will help ensure safe and accurate medication administration for your client.